Thank you very much for inviting me to come speak. My name's Carrie Kovarik, and today I'm going to be talking with you about AccessDerm. This is a program. We're going to switch gears a little bit. We've been talking a lot about engaging patients, and this is the first application that we've discussed today, I believe, where it's physician-to-physician interaction. So I'm going to start with a clinical scenario, and this actually happened about 2 weeks ago with our AccessDerm system. So imagine yourself as an immigrant to Philadelphia. You've been here a few years, but English is still your second language, and you live in North Philadelphia and you have no health insurance. You're about 40 years old and you had a lot of sun exposure as a child, and one day you notice this. This isn't the actual picture, but this looks very similar to what she noticed on her trunk. You're worried. You go to your local Philadelphia City Health Center, and your clinician is also worried, but she doesn't have any way to send you to the dermatologist. You're wondering, is this a melanoma? We need to get this checked. So what do? You have no way to be referred to a dermatologist unless you're going to self-pay, and this patient didn't have that ability. So this is what I'm going to talk about today. It's a program called AccessDerm that we've developed in conjunction with the American Academy of Dermatology, and Dr. Kovarik has been a great mentor to me and the American Academy on this project. This mobile application delivers dermatologic care to underserved populations in the U.S., but it really has a bigger application than that I'm going to explain in a moment. This application allows primary care clinicians to send telemedicine or teledermatology consults using their own phones in a HIPAA-compliant manner, and I'll go through the workflow. And it's available on iPhone, Android, and the web, and soon it'll be available on the iPad. So this is how it works. Let me just describe the flow. A patient comes in to one of the clinics, and I'll tell you about all the clinics that we're in. Comes into, for example, one of the city health clinics where we have this. A primary care provider realizes that they need a derm consult. They take their phone out, they access the application, they log in, they enter the clinical information, take the photos, and press send. The clinicians in Philadelphia are linked with us at Penn. We have a group of dermatologists providing this care, and we receive an alert that there's a case. We log on, whoever grabs it first answers the case, and then once it's answered, the primary care clinician also gets a notice. And I'll talk more about who's involved and how quickly we actually get this done. So let me show you the interface. I've shown you in these pictures the iPhone interface and what it looks like. It's available on the iTunes Store, the Android Marketplace, but you can't really use it unless you're registered into the system. You can also use the website. So most of our clinicians do have an Android or an iPhone, but if they don't, they can use the website and a camera, which we provided to the clinics. Once you log on, you can see that the cases are arranged in this almost like an inbox, like an email inbox. And this application has gone through so many iterations, and this is the newest one that the clinicians really love. We've gone through so many iterations because what we thought in our mind would work into the workflow of the clinic and be user-friendly actually really wasn't once it got out into the clinics. But this is something that's intuitive. People are familiar with the inbox, and they know when there's something marked with a star, like you can see at the top, that that's something new that needs to be opened. And they don't need a lot of training to be able to use this. So you log into the application as the primary care provider. On the far side, you can see some of the case details that they'll enter on their phone. They can add photos. Right now they can add up to 4, and they can also save a draft. So if they're not done with the case and they want to finish later either on their phone or on their computer, they can do that. It's all synced through the cloud server, and they're all synced through all the devices, so you can do it interchangeably if you'd like. Once it's submitted, I get many notifications, and you can elect to get one or several of these, but you'll get an email, you'll get a push notification. And then once the notification goes back to the primary care provider, you can see they can log on and see what I wrote here as the answer. So AccessDerm has been created for underserved populations. That was the goal in mind. And this was really to provide derm care to people who don't have access to care, either because they can't pay for it or they're geographically removed from places where they can get care. So that's socioeconomic barriers, geographic barriers, or even temporal barriers. Right now at Penn, I think my next available is 7 months. That's pretty difficult to get a derm consult no matter where you are. So this is the timeline of the AccessDerm platform. We started developing this in 2009, and like was mentioned in the last presentation, we started on Java-based phones as well, and just over the last 4 years, it's gone from nobody having a smartphone to almost everybody having a smartphone. In the old system, we had almost 500 consults nationwide. We didn't just roll this out in Philadelphia, but in 26 clinics throughout the U.S. in conjunction with the AAD. And our newest version of the platform was launched in November of 2012, the one that I showed you. This is where we're located in Philadelphia. We're in, I believe, all but 2 of the Philadelphia health centers, which are 10 in number. We're also in the Sarah Clinic and the LAC Center, which are affiliated with Penn. This just gives you an idea of how many consults come in per month. So this is happening as we scale. You can see in November 12 we changed platforms, and now it's really swooping up as we do the training. The red ones are the Philadelphia clinics that are using this now. The blue ones are in other locations throughout the country. You can see our clinics, the LAC Center and the Sarah Clinic, which have been involved since 2009, really like this platform. And you're wondering, well, how fast do the dermatologists answer these consults? Well, it's almost like a competition for us to grab the case first, and now we also have built residents into the workflow, so the residents grab the case, and then they release it to the attending for approval or editing, and then it goes to the PCP. And that whole workflow on average takes 19 hours, and if you only count business hours, it's only 5 business hours, so it's very rapid response. And what we also like to highlight is the fact that if this service was not available, who would have gotten derm input or a derm consult? So from the initial numbers, and we only have a small number of cases so far, but 2/3 of those patients wouldn't have been able to access derm care at all. And then you might also wonder, well, some of those patients need to be seen in person, I'm sure, like the person with the melanoma that we saw at the beginning. Well, to be involved in AccessDerm, you have to also agree to be a safety net for these clinics. So either find them a place to be seen or be seen at your own clinic. And only about 20% needed to be seen in person. And really, I believe it could be less than that. Clinicians love this. And the one thing on this slide I'd like to point out is in the bottom corner here. We asked the clinicians, if you had your choice of ways to submit these consults, how would you like to do it? And they all, or the majority, big majority, said cellular phones. They love the fact that they can pull their cell phone out, do the consult. It doesn't interfere in a major way with their workflow. And we have some very enthusiastic clinicians who say, this isn't only good for my patients, but it's a great educational experience. And our clinician who we found the melanoma on her patient was, of course, very grateful. So there is evidence, and people may be wondering, well, what's been done in this field? Well, over and over there have been great studies showing that teledermatology is effective. There's good concordance between in-person and telederm diagnoses. There's good quality of life between the two, irrespective of how care is provided. And we've also done some studies to show that mobile teledermatology also works. So the last part of this talk, I just wanted to introduce you to a couple studies that we're doing. We want to show that this is effective, and we're currently doing a study in the Philadelphia health centers as well as those other 2 clinics I described in order to show that you can manage a lot of these derm conditions through mobile teledermatology, and mobile teledermatology can also help improve access. And we're also, while we're at it, showing that the concordance is appropriate, just like many of the other studies have done. We have about 42 patients enrolled out of the 200, which is our goal. But as you can see, primary care providers love it. We only really needed 25, but so far we have 58 that have enrolled. We're also doing an inpatient study to show that AccessDerm and mobile teledermatology can be used to triage difficult inpatients. It's a huge problem in the dermatology community to provide inpatient consults, especially in rural hospitals. people in their practices are just not going to these hospitals to provide care. Here at Penn, you call, you get one of the best derm consult teams come running within an hour or two. That doesn't happen everywhere in the country, and this could be a way to triage inpatient consults or provide diagnoses. So we're trying to show that triage plans or even management plans are similar whether you're using mobile teledermatology or you're actually going to the hospital. And we are nearing the target of enrollment. So our future directions, we really hope to use this as a model to improve dermatologic care access. We want to enable providers a way to give derm care in an easy way. This has been our main goal, make this user-friendly, easy, work into the workflow of the providers. We also want to show it can be used as inpatient care for triage. And this could be used for other specialties. Dermatology is a natural fit, so this is, and I'm a dermatologist, so that's why we did it this way. But the last thing is this can really change payment models and how we can be reimbursed for telemedicine. We've already been approached by several organizations who would like to use this and actually pay for the service in different ways. And I would like to acknowledge, in particular, Caroline Nelson, who's my medical student, who's really who did 5 different IRBs for our study and has trained hundreds of clinicians on how to use this.